Corona Mamas, how are you today? I am so excited. We have a special guest. We have Dr. Desiree McCarthy Keith with Shady Grove Fertility here in Atlanta, and she's their medical director. And I'm so excited for her to talk to you all today. I know there's so many questions out there regarding infertility and fertility treatments and everything, especially now during the time of the pandemic. And so we're so excited that she's here today to share her knowledge. Thank you for joining us today.
Thank you. I'm so happy to be here. And hello to all the Corona Mamas. This is an awesome platform. So I'm just happy to be here. And I love you.
Thank you. Thank you. I one of the things that inspired me to have you on was actually I heard you on the Sugar podcast. And I
Yeah.
was like,
Mhm.
you talked so much about all the ins and outs of, fertility and all the different options and infertility, male, female, and, the partnership that goes along with it. But I'm like, man, outside of the basics of it and how complex it could be, I bet it's maybe even that much more complex during the pandemic. And so that's really why I wanted to have you on today. But first, if you could just kind of start out and tell us about yourself, your family, your practice.
Absolutely. Well, I have been in Atlanta for 10 years. I'm originally from North Carolina. I practiced general OBGYN for almost 5 years before becoming an infertility specialist. So I saw women who are going through fertility treatments or just have fertility concerns, even when I was a general OBGYN. And I was always just drawn to that from my residency and through my practice and just wanted to get more involved in that. So I went back and did a fellowship at the NIH and at Walter Reed in DC and Maryland, and really just took 3 years to learn infertility and take care of women and couples who were going through fertility treatment, and then moved here to Atlanta in December of 2010. And I've been in my practice, the same practice since then. We were initially GRS, or Georgia Reproductive Specialists, and then we merged with SGF, or Shady Grove Fertility, in 2017. And like you mentioned, I'm the medical director here. It's fun and it's rewarding, and it's just an amazing field, the science behind what we do, and just the personal connection that we build with our patients and relationships. It just makes it a very special field. So I love what I do. It's exciting and fun, and it's a lot. It just gives me a lot of just pride and purpose to really be here and to do this and help couples and patients. So I have two sons of my own. So as a Corona mama, I can definitely relate to being a working woman and a parent in the evening, and second job in the evening is harder than the first job during the day. So my sons are about to turn 13 and 17. I am a single parent, and so that adds another layer there. But I have a lot of support from my son's dad, so we co-parent and we work it out. But I love my boys, and that also just gives me more purpose. The feeling I have for my children, and to know how I felt when they were born, and to see them for the first time in their lives. I'm like, who doesn't want to have that? So when people come to me and say they want to be a parent, I know what that feels like, and I want to help as many people as I can to have that experience.
Awesome. Yeah, I mean, definitely, I can imagine the vulnerabilities of people that you see who come in and, they've maybe been trying for however long to have children, and, they just have to pour themselves out to you. And so to have someone like you to listen, to them and genuinely care for them and walk them through that, that's such a special experience, I'm sure.
Yeah, it is. And it's an honor for me, because it is such an intimate experience and process. So it's a privilege when patients actually welcome us into that part of their lives and just guide them through that process. So yeah,
Yeah.
special.
And I can imagine even more so, during the pandemic. And so, today we're not necessarily going to focus on the ins and outs of, the various fertility treatments and options. We'll definitely have that listed in the show notes where they can go to your website and kind of get any further information with regard to that. But tell us a little bit about some of the unique challenges that you all have experienced during this process of, the pandemic.
hmm the biggest challenge was that when COVID really started to become a real thing and a real threat, all the medicine just shut down, and it went down to just the most urgent cases. And so we had a lot of challenges initially because we see fertility care and we understand that fertility care is essential care for so many women and couples. This is not an elective thing that you can just put off until the pandemic is over. For many of our patients, it's time sensitive. So we don't have the luxury to say, we're just going to wait until next year to have our baby. We have women who are advancing in their age, they might have lower egg reserve already. And those are not women that we can say we're just going to wait out the pandemic and have our baby, next time. So that was what we really dealt with primarily in the beginning, was just, how to practice safely, but still how to honor our commitment to, fertility care, and making sure that we were still providing essential care, especially in those really time sensitive cases. We did bring our services down to really just the time sensitive urgent cases for just a few months. But by May, when we really saw that this was not, COVID wasn't going away anytime soon, then we had to make the decision, we can't stop practicing and taking care of couples until the pandemic is over, with a question mark of when that will be. So how are we going to continue to serve our patients as safely as possible? So from May forward, that's when we put our protocols into place for how to maintain distance,
Mhm.
provide a safe environment in the office, but still, help all the people who need our services.
Sure, sure. And how did this affect some of the support systems that the families have in place with the visitation and spousal support or birthing partner support and all of those types of things?
And so we only bring in patients who are going through their treatment right now. We are not bringing partners and visitors into the office, because that could potentially double the volume of people who are moving through our office at any particular time. So I just had to kind of balance between how can we continue to take care of our patients, help them to have their families and become parents, but reduce the risk and exposure for patients and staff who are in the office. So we do a lot of remote visits. We do virtual consults for discussing treatment plans or initial evaluations. But we definitely bring patients into the office and we can do all the diagnostics. We're doing all of our procedures, in vitro, egg retrievals, inseminations, but it is different, this year. And that's been tough for some patients.
Sure, I bet. And,
Mhm.
with regard to the framework around speaking with women about contracting COVID, if they've ever had COVID, if they have positive antibodies or not, what sorts of conversations are you having surrounding that?
We definitely, I think like most medical offices now, we have a questionnaire, we have temperature screening. Really, we say if you have any of these symptoms, please do not come to the office until you are sure that you are, recovered from your illness. But if there's a question mark, we just cannot risk having that exposure that can spread to so many people in a confined space in our office. And so we do the screening that everyone else does. We also have employee screening to make sure that we're providing the safest environment for everybody. And sometimes that means, a patient's ready to get started with her treatment and she tests positive for COVID, or she has an exposure. And that means that we need to wait out that, isolation period and then start up their treatment the next month or when they're recovered.
Sure. And so that brings up an interesting question. If a woman has had COVID, does
Mhm.
that limit her treatment options?
It does not. The main thing is that if it's an acute infection, if she's having symptoms, then we just have to isolate her from the office until she is recovered. But we have many patients who have been exposed or they would develop COVID themselves. And once they get through their incubation period and they're completely back to their baseline, then we're able to resume their treatments after that. We just have to wait out that period until it's safe for her to come into the office.
Okay. And are you doing, once a family conceives, is there a special testing process that they go through to test them for COVID on a regular basis during that early phase at all?
Mm-mm. And we follow at SGF, we follow the CDC, American College of OBGYN. We're looking at the FDA. we're looking at, the main organizations that give us guidance for how we manage patients and counsel them about these type of situations. And there's no recommendation at this point that says, routine testing or anything. It's the same. We just have this on loop now. We say, wash your hands, keep your distance, wear your mask, avoid crowds. And it's this, we can rattle it off in our sleep. And it's the same guidance that we give to you and me, pregnant or not, to my sons, to pregnant women. So that the foundation of how we're really going to get past COVID is to do those basic things and to get as many people vaccinated as we can. I mean, we're going to have to do those in tandem.
Right, right. And that's a great segue when you mention vaccine, because, I think a lot of people outside of the medical field, when they consider a pregnant woman or a woman that's trying to conceive, their mind just jumps to the baby or the fetus or the infant, and not really realizing,
Hmm.
well, this child has to incubate within a healthy woman. So, the
Exactly.
focus it has to be on healthy mother, healthy baby. And so talk a little bit about, the vaccine and, any particular limitations with regard to that and the recommendations.
As far as vaccination, again, we're very just upfront and honest with patients. We sent out a letter because we were getting, hourly questions from patients that were saying, should I get the vaccine? Can I get the vaccine? Should I postpone it? Should I postpone pregnancy after I'm vaccinated? All these kind of things. And I mean, we are just coming up on a year of COVID being in this country.
Yeah.
So we have to be honest about, we don't have long-term studies and data about this disease and how it affects any of us, including pregnant women trying to conceive. But what we look at is just, preliminary data does not show that, women who are pregnant or trying to get pregnant should avoid a vaccine or should behave any differently. And
Right.
again, the CDC looks at the guidelines that say if you're in an exposure group where you are offered the vaccine, pregnant or trying to get pregnant is not a reason to not receive the vaccine. And so that's what that's the guidance that we follow for our patients also.
Sure, sure. I mean, it's like, it's ever changing, throughout the process. And it's all
It
we can do
is.
is just be upfront and honest and just let them know, as long as you're doing taking those safety measures, watching your distance, washing your hands, wearing your face mask, that those protections are key and essential.
That's
One of the
it.
things that I
That's it. And then
found
for us
actually,
to be vaccinated,
yes, yes,
I was saying
definitely.
for us to be vaccinated, I got my vaccine, I got my second dose about a week ago. And so I
Hmm.
think that that's helpful too, and reassuring to patients who come into the office to know that their doctors and the people in the office are vaccinated, so they feel like it's a safer environment for them to be in also. And, we get vaccinated and then we're on V-Safe. So we're getting that weekly, like, how you doing? Checking in. Are you having any symptoms? So we're
Yeah,
all reporting our experiences and contributing to the data for how this vaccine is really going to impact everybody.
yeah. And so let me ask you, how do you counsel patients who say they don't want the vaccine?
Hmm. I mean, the thing about it, being an infertility doctor, is that you have to be non-judgmental all the time.
Right.
And so, we have, and it's because we're not there when people come to you for help, they're not coming for your judgment. They're
Mhm.
coming because they genuinely, value your expertise or your care. And so we have to consider that in how we talk to people and just how we treat them when they come in or when they're seeking our help. And so it's the same thing with the vaccine. When patients really say, I'm afraid of the vaccine, there's not enough data about it that makes me feel comfortable, I don't want to have that, then of course we say that is your right to do that. We just want you to follow, the guidance and the science, and then make your own best informed decision for yourself. And so we support that. We definitely don't, you know, strongly encourage or discourage. We say, this is the information, this is what we know to date. And we want you and your partner, if there's a partner, to just make an informed decision that's going to be right for you.
Yeah, definitely. And so, I know you had mentioned, you guys created the FAQ and everything that you give the patients.
Hmm.
And I read over them. And one interesting point that I read on there that I'd never even considered, you mentioned finding
I know
some
what you're going
COVID
to
in
say.
semen.
Yeah, the sperm, yes.
Yeah. So
Yeah.
tell the Corona mamas who are looking to get pregnant a little bit about that. And, they may have some questions, concerns, or fears surrounding that.
Well, what we said in the FAQ is yes, there have been some limited studies that have identified COVID in a semen sample, but that's no different than other viruses. We know that, semen and sperm can transmit other viruses. That's how people get STDs and things like that. And so we've also have some evidence that there may be COVID there. We don't have evidence that that is a way for you to catch a COVID infection or things like that, but we have seen virus in a semen sample.
Sure. So, basically they don't tell them to get their semen tested for COVID
Right.
prior to
Absolutely.
infertility therapy or treatments or anything like that.
Absolutely not.
Okay.
Absolutely not. No, we're not recommending that.
Yeah.
I knew you were going to ask
Yeah.
that.
Just want to make sure because those questions come up. Some people are afraid to ask it out loud, so they'll be Googling
Yeah.
it and searching it online. And so we just want to make sure that they have that information. And so tell me, is there anything that we haven't discussed that you think that Corona mamas out there, anybody that specifically need to know about?
Absolutely. I mean, we're talking general about COVID and just life, but as a fertility doctor and as a Black fertility doctor, I cannot leave this platform without just saying our age matters, our lifestyle matters, and our outcomes are different as people of color than other ethnic groups. And so we have to think about that. There are unique um, diagnoses and experiences that we have going through the fertility system that we have to be aware of. Our age is the biggest factor, and that's not an ethnicity thing, but age for ladies really matters. And I see ladies on a daily basis who are first seeking care at 50 and very surprised when I talk to them about what their egg supply naturally is at those ages.
Yeah.
And so we get very comfortable when we see celebrities who are seemingly pregnant very easily, and it's glamorous and it looks like being pregnant at 50 just happens overnight, and that's just not the reality. So our fertility changes a lot. So we got to think about it. By the mid 30s, egg counts drifting down close to 40. We're seeing very significant changes in egg reserve and egg quality. So I always just urge and encourage women and the women that they know to seek fertility care early. If you're having trouble, don't wait. Don't let the stigma and the shame and all the kind of cultural things that sometimes we embrace and internalize keep you from getting the care when there's still time for it to make a difference. So our age is a big factor. And then lifestyle is the other. And I am a big advocate for just healthy lifestyle. I've been vegan now for almost 5 years and vegetarian for almost 9. And I've seen the difference that just changing my lifestyle has made personally in my diet. So I advocate for that. When we look at chronic diseases, you as a colorectal surgeon see it.
Yeah.
We are more prone to, diet and lifestyle related conditions of cancers and heart disease and diabetes. And those are modifiable things that we can impact just by changing, how we're living and the quality of our food. So that's another big focus for me is just healthy weight, healthy lifestyle, and having a good start when you come for your fertility treatment. So when you look at studies of women going through fertility treatment, Black women are always in the highest BMI group. So we're the heaviest, overweight and obese compared to other groups, and that's modifiable.
Sure.
So you got to think about it.
Definitely, definitely. And one of the things, we at Corona Mamas address not only the pandemic of COVID-19, but the pandemic of social injustice and racism. And so I'm glad
There
you
is.
brought that, particular topic up. And, if there would be, one thing that you would say is the biggest contributor to contrib contributor, excuse me, to the disparity between African American women, people and women of color getting access to their fertility treatments
Mhm.
as compared to their white counterparts. What would you say that is?
It is our culture and our community. And so there is still a lot of stigma and shame and really misinformation in our community that makes women uncomfortable to seek treatment, embarrassed. Maybe they don't think they know anyone who's had fertility treatment, so they don't even know where to go. But I always say, I promise you, they may not be talking about it, but you are sitting next to women in your church, on the train, at work who have been in the same office and having the same conversations that you're having. So a lot of our culture and just experience really keeps us from getting to the treatment as fast. It makes us more likely to delay, and then we have the other factors by the time we get there. So that's a big factor. And then the other big is, just the social injustice, like you mentioned. We were really not a part of the fertility conversation when fertility care started in this country. So, like in the early 80s, all the campaigns and all the flyers and things like that did not have women of color on them. It was a middle class white woman who was saying, if you're having trouble getting pregnant, you should go and see a specialist. And so, if you were struggling and you don't see any brown people on the flyers, and you think they must not be talking to me, this must not be treatment that was intended for me.
Right.
And so that really, kept us out of the conversation for a while. We've gotten a lot better
Sure.
in the last decade or so, and just the visibility of Black women going through treatment, speaking out about it, Black fertility providers. Michelle Obama was very open about it in her book. We've seen Gabrielle Union, and it's becoming more of a conversation, and that's just helpful to normalize all of this. It is not something that only a couple of people do and they do it but we don't, but this is just medical care
Right.
that we all deserve and have access to.
Yeah, definitely. And,
Mhm.
for those who are hesitant to broach the subject because they're worried about, cost or coverage through their insurer, what would you say to them?
That's a misconception too. A lot of people think if I go to the fertility doctor, that means I'm doing an $1,000 dude. And that's just not true. There are less expensive fertility options. Everyone doesn't do IVF. About 50 to 60% of patients in Georgia have fertility coverage through their insurance. And so that shouldn't be a deterrent. At SGF, we have financial programs and different packages that can help patients to afford fertility care. So we don't want cost to be something that just keeps them from even coming in the door. You got to get the information, and you always have options.
Yes, yes. So, all you women who are interested in fertility treatments, if you are insured, reach out to your insurance company and
Mhm.
just see, get their basic plans and what they have coverage for. And if it's something you're interested in, contact the, fertility specialists in your area. And just like, Dr. McCarthy Keith just mentioned, lots of times there are services and plans that are available. So, don't let that hold you back from having your, beautiful, healthy family, however you want it to happen.
Absolutely.
Yeah.
Absolutely.
So before we come to a close, I would like to
Mhm.
finally ask, what from COVID do you think will continue and persist in your personal life and then also in your professional life?
I'll answer professional first because I think that's easier. We've done a lot of telemedicine, and I think that that is here to stay in some form or fashion, because what we've learned, especially again, because fertility care is intimate and personal, is that when I meet patients for the first time and they're in their home, they're more comfortable. And so they're a little bit more relaxed, and it's a different conversation, I think, for them to have that kind of first meeting on their own turf,
Yeah,
so to say, as opposed to coming to an office where it's tight and it's rigid and it's like I'm in a doctor's office and it's a different feeling. So I
right.
think that patients can appreciate that. And that just gives them a better experience. I think that we'll go back into the office, but there will be some form of still offering virtual visits to patients, whether they're across the country or just in town, that we will maintain that in our practice. It's also just taught us how to practice safely. I mean,
Yeah,
we have all just gotten a crash course in sanitation and infection control and all of these, public health measures. So I think that those are things that will stay with us and that we will incorporate into our practice for sure.
right.
I think that what it's taught me personally is grace and gratitude because I see so many people who are struggling, and it's so easy to retaliate or to fight back or to just have a kind of negative reaction. But you have to pause and think, we're struggling right now. And when people are acting out, or somebody cuts you off on the highway, or you feel like somebody did you wrong,
Yeah,
we've got to show people grace, and we've got to expect grace for ourselves, especially right now. We have to be forgiving and understanding of where people are in their life
yeah,
and how that because there are many people, gratitude for certain, because there are many people who are no longer with us in this past year who have really just not survived COVID. And that is sobering. But at the same time, it makes me so grateful for everything that I have. Grateful to be healthy, grateful that my family's healthy and that we're just hunkering down and doing what we need to do. We miss, my boys and I always talk about it. We just miss being able to go to the amusement park and ride and scream on the roller coaster. But at the same time, if we have to do this for a little bit longer so that we can be healthy and safe, I'm grateful for everything that we have right now and that we're still here and moving forward. So, every day you can turn on the news and just get broken down by the statistics and by all the things happening. And so I always just say, what's good? We got to focus on what's good,
Yep.
because sometimes you just can think that it's all bad. And we recognize the things that are challenging, but we still have to look for the goodness in every day and look for the goodness in people, really.
Yeah, definitely. Great, great
Mhm.
closing. Grace and gratitude.
Yes.
So,
That's
well,
it.
thank you so much, Dr. Desiree McCarthy Keith. She is the epitome of grace and gratitude. Every time I see her, smile on her face, super friendly. I would definitely, if I needed it, would have definitely been the first one in your office to get my fertility treatment and everything. But so grateful of how gracious you are in all your service and how you take care of your patients and your friends and your family. So thanks for being here today.
Thank you so much for having me. It's my pleasure. This is a fantastic Corona Mamas. I love it. I love it. So I hope that I can come back and talk to you again. I
Most
do.
definitely.
Thank you for everything that you do.
No problem. Thanks so much. All right, Corona Mamas, I will see you next
Yeah.
time. Bye.
Bye, everybody.